I recently traveled to Ellicottville, famous for its abundant beauty this time of year and the ski slopes of Holiday Valley in the winter. Also growing in notoriety in Ellicottville is Homegrown Pediatrics, owned by Dr. Kate Johnson Clark. She operates a unique model called direct primary care, of which even includes house calls. This model is growing in popularity throughout the country, giving providers the autonomy to practice medicine the way they feel is best, not dictated by bureaucracy. Listen in to learn more.
My name is Dr. Caitlin Johnson Clark. I'm known to many of my patients as Dr. Kate. I would say most of Buffalo knows me as Dr. Kate because I'm a pediatrician. So when you're a kid doctor, it's nice to not have to go with the formality of Dr. Johnson-Clark. So Dr. Kate, I own a direct primary care office in Ellicottville, New York called Homegrown Pediatrics. I was asked recently why I went into medicine or pediatrics to begin with. And I will say it wasn't necessarily the plan. I knew I liked medicine. I liked children. When I went to college, I actually majored in mathematics and I did a minor in art. So I would say being a pediatrician probably wasn't on the direct road at that point. So I finished school. I taught math for a year as a substitute, a long-term substitute at a local school, and realized that I liked math a lot more than my students, but I still liked the students. So I thought I have to do something different. So on the side, I actually took a EMT course and I started working as a nurse's aide. So I did that for a year and I realized I wanted to be a physician. So I applied to medical school and the road started. The very, very long road of medicine started. Pediatrics was always at the forefront every time I was in a pediatric rotation. I think children gravitate towards me. A lot of times I get hugs and kisses during my visits, and I think that that's because I'm meant to be a pediatrician. So I finished all of my training and moved home. So I live where I grew up. That was not the plan either. The plan was to be like a physician somewhere I'd never been before, but I fell in love with a local boy and we moved home, and this is where we're at. Homegrown Pediatrics is a direct primary care. So I get that question a lot, what is a direct primary care? The model of medicine that is a DPC is the idea that a physician can be a physician. There's no middleman, there's nobody that tells me what to do. I answer to my families and I answer to the children that they have. So it creates a different type of relationship in medicine and is a nice little homage to what medicine used to be years and years ago, when a family came into an office, saw the pediatrician, paid for their services, and left. There was no insurance billing. There was no, oh my God, did I check enough boxes? There was no, did I do enough for this child to get paid? The relationship was between the family and the doctor. And that's what DPC is. It's a relationship between the patient and the physician, and the way medicine should be. We've kind of fallen away from where medicine truly needs to be, and we're getting ourselves into quite the bind in taking care of families and taking care of people and keeping people healthy. So why did I go down this road to DPC? I finished residency here in Buffalo. I started my first job in a general pediatric clinic, thinking that that's exactly what I wanted to do and be, and I didn't like it. I saw 45 to 50 patients a day. That was in an 8 to 10 hour day. I had to do each patient in 15 minutes, or I would get a call from administration. I had to bill them a certain way. I hated it. And then I had to chart. Like, then you're supposed to write all these things down that you told a parent and that you didn't really tell a parent. Because how can you help a parent raise a child in 15 minutes? It's just not possible. So I didn't like it. So I remember going home to my husband and 2 children at the time and telling my husband I didn't want to be a physician anymore. That was hard. Oh gosh. I got a little emotional about that. That was hard because I really did want to be a good pediatrician, and I felt like I wasn't being a good pediatrician. Out of my 2,500 patients I had on my list, I knew maybe 20 families well. So I always wondered about the other thousands of patients who was caring for them, because I certainly was not. So my husband said, well, we have to do something different, because you went to school for a very long time to be a physician and you're good at it. So that kind of took us down the road to DPC. We went to a conference, we asked questions. I have a friend who does a DPC practice in Lewiston. I talked to her, asked lots and lots of research, and discovered that this is the medicine that I wanted to practice, that I wanted to be a doctor who knew my families, who could spend an hour talking about like how to breastfeed, like what the best bottle was, if we should use pacifiers, how to lay a baby down to sleep. To be able to have that time and energy to do that without being told that I only had 10 to 15 minutes and I had to hurry. So I started my business. One of the biggest things I do here is I do house calls, because I think that that's missing in medicine, and it makes a huge difference when it comes to having a baby where a mom is just getting to learn her new baby, and you go to their house and they invite you inside and you talk about their baby for a couple hours and you discuss how to feed them, and they ask you about this little thing that they bought or this little thing that somebody gave them, and it becomes a very organic experience, and they trust you as a physician, and their children grow up and trust you as their physician. I have many toddlers that I spent many hours in their homes playing with them, for lack of a better word, but really doing developmental checks, who now come into my office and they're not afraid. They know me, I've become part of their existence, and that's, I think, how it should be with pediatrics. So once we transition from house calls, we transition to a clinic that looks like a house. And honestly, I think the kids don't realize they're being checked up or developmentally assessed, because they're so comfortable in this setting. And that is inherently why DPC works for me. So my office is located in New York State, which we all love this state sometimes. It can have some regulations. So DPC isn't well known yet in New York. There are quite a few of us. If you looked, a good 20 to 30, I would bet, but not that many in Buffalo. There's about 3 offices that I know of. Everyone in those offices wants the best for their patients, which is where DPC is easy to sell, because once you walk in these doors and once you experience what DPC is and how that medicine is different, you realize that medicine can be different. But in order to get people in the doors into this DPC lifestyle, it takes a lot of explanation, because people don't believe it. They are so used to being worked through this factory-based system where they go in and they wait an hour to be seen for 10 minutes, that they think that that's just how medicine is. So when you bring up DPC and you bring up those changes and what we want to do for people in healthcare, some people don't believe you. And New York State, the way we operate in New York State is a little bit of a tougher sell. But I will tell you that every family who's walked in these doors and met me and talked about DPC has joined this practice, because this works, and these families are healthier, they're taken care of better than families in this traditional, and I guess we can call it traditional at this point, in this traditional system where we just push people through and hope that they just get better. This system, we take the time, we sit down, we talk about things. I have complicated kids. They're taken care of differently here than they are in the system that there is now. So this will be a good sell. DPC will work. I think that there are going to be some great offices opening up. There are some residents coming out of training and they want something different. And as soon as we get that push and people to catch on, it's gonna be big. So my husband and I moved back to this cute little town of Ellicottville, New York, which I will say is becoming younger by the day. The families that are moving into this area, we're having a great time. And I often get asked what's the best place to eat in Ellicottville. And that's a hard one, because it's Ellicottville. So there are a lot of really delicious choices. The taqueria is fantastic. West Roads is probably my favorite. Ellicottville Brewing Company, I mean, you can't really go wrong there. There's really just so many places to explore in Ellicottville now, and it's a great little town. So if you're looking for country and a good pediatrician, you should move to Ellicottville.